I provided privacy for my patient by closing the doors in the room. Hi, my name's Nicole and I'm an Oakland University nursing student. What's your name?
Molly.
Hi, Molly. Nice to meet you. How are you?
Good.
Good. So today's assessment will be on your lungs, heart, and abdomen. Is that okay with you?
Yeah.
Okay, perfect. I'm just going to start by washing my hands and asking you a few questions. So have you had any problems with your lungs, heart, or abdomen?
No.
Okay, good. And have you had any surgeries on your lungs, heart, or abdomen?
No.
Okay, good. And has anyone in your family had a history of problems with their lungs, heart, or abdomen?
No.
Okay. And do you take part in any drinking of alcohol, smoking, vaping, or any illicit drugs?
No.
Good. And do you experience shortness of breath, coughing, swelling, chest pain, abdominal pain, or nausea or vomiting?
No.
Perfect. So I can now move on to the general survey of my patient. So can you tell me how old you are, Molly?
15.
And what gender do you identify with?
Female.
So Molly is a 15-year-old female. And who is the current president?
Joe Biden.
Okay, and what's today's date?
March 12th.
And where are you right now?
My house.
And why are you here today?
For a checkup.
Good. So she's answered 4 out of 4 questions correctly. Therefore, I can note her level of consciousness as alert and oriented ×4. So as I look at Molly, I can see that her skin color is a pink, fair undertone, and her facial expression appears to be relaxed, and her speech seems to be clear and articulate. I also see that her face and body are symmetrical on both sides, and she is dressed appropriately. She has adequate hygiene. There's no body odor, and I can note that there are no physical deformities present that I can see as well. Okay, so we can now move on to your back. If you want to go ahead and turn around for me, if you don't mind. Thank you. Okay, so inspecting Molly's posterior chest, I can see that her skin color is consistent with the rest of her body. I also see that her spine is midline. There's no scoliosis. I also see it's symmetrical on both sides. I don't see any abnormal lesions, so no abnormal lesions there. Everything seems to look good. So I'm going to go ahead and move on to palpation. I'm going to use the back of my hands and just feel. I feel that she is warm to touch. So I can now check symmetrical expansion. I'm going to go ahead and take a deep breath for me. Good. So I can note that Molly has symmetrical expansion of her posterior chest. And now I can move on to the auscultation. I'm just going to be using the diaphragm of my stethoscope to listen to her lung sounds. So can you go ahead and cross your arms in front of your chest for me? Perfect. And just take a deep breath when you feel my stethoscope. Okay, perfect. So Molly's lungs are clear to auscultation. I didn't hear any abnormal sounds or crackles or wheezing. So I can go ahead and move on to her neck. If you want to go ahead and turn back around for me. Thank you. I'm just going to feel her carotid artery for the pulse. Just going to move this a little on the left and then on the right. Okay, I feel that she has a regular, steady rhythm and a pulse strength of 2+, so everything looks good with the neck. I can now move on to the anterior chest. If you want to go ahead and move your gown down a little for me, if you don't mind. Okay, thank you. So inspecting the anterior chest, I see that the skin color is consistent with the rest of the body. I do not see any abnormal lesions present. I also see the costal angle is less than 90 degrees. And her ratio of anterior to posterior diameter to transverse diameter is 1:2, which is normal. And looking at her breathing, I see that she has a steady breathing pattern, and I note that she has no use of accessory muscles, and I do not see any muscle retraction or bulging. So I can note that her respiratory rate should be 12 to 20 because everything looks good with her breathing. So now I'm going to move on to the palpation. I'm just going to feel with the back of my hands. Okay, I feel she's warm to touch, and using my fingers, I do not feel any tenderness. So I can now move on to the auscultation. I'm just going to be using the diaphragm of my stethoscope. Same thing here. Take a deep breath in and out when you feel my stethoscope. Okay, so everything looks good there. So I can note that her lung fields are clear to auscultation, and I can now move on to the heart. So I'm just going to be using the diaphragm of my stethoscope here and feeling each valve. I'm going to start using the diaphragm to listen for the high-pitched sounds. I'm going to do the aortic valve area, which is right to the sternal border at the second intercostal space. And then the pulmonic valve area, which is left to the sternal border at the second intercostal space. And the tricuspid valve area, which is left to the sternal border at the fourth intercostal space. And the mitral valve area, which is straight from the midclavicular line, left to the sternal border at the fifth intercostal space. Okay, so everything's good there. S1 and S2 sounds have a regular rhythm, so I can now listen with the bell of my stethoscope for low-pitched sounds like murmurs. So I'm going to do the same places here. I'm going to do the aortic valve area and the pulmonic valve area and the tricuspid valve area and the mitral valve area. Okay, so everything sounds good there. I didn't hear any murmurs. So I can now move on to the abdomen. If you want to go ahead and lay down for me. Okay, I'm going to start with the inspection. I'm just going to lift this up if you don't mind. Okay, so looking at the skin color, I see that the skin color is consistent with the rest of her body. I also see that there are no abnormal lesions present. And I see it's symmetrical on both sides, and the umbilicus is midline, and the contour is flat. So everything's good there. I can move on to the auscultation of her bowel sounds. So I'm just going to go ahead and listen with the diaphragm of my stethoscope. I'm going to start in the right lower quadrant. And then the right upper quadrant. And the left upper quadrant. And the left lower quadrant. Okay, so everything is good there. I can note that she has normal and active bowel sounds, and I'm now going to move on to the percussion. So I'm just going to start in the right lower quadrant again. Right upper quadrant. Left upper quadrant. And left lower quadrant. Okay, so tympany was heard in all four quadrants, so I can now move on to the palpation, and I'm just going to do the same thing. I'm going to start with the right lower quadrant and do some circles, and the right upper quadrant, and the left upper quadrant, and the left lower quadrant. Okay, so everything's good there, and I did not feel any masses as I did that. So did you feel any pain as I did that at all?
No.
Okay, so I can note that Molly has no pain or tenderness as well as no murmurs. You can go ahead and sit back up if you would like. Thank you. Okay, and do you have any questions for me?
No.
Okay, I'm just going to wash my hands and thank you for your time.